Hello, this is Dr. Eldred Taylor, and we're here with Dr. Lisa Nagy. She is going to be one of our speakers at our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia on November the 10th through the 12th, 2016. Now, Dr. Lisa Nagy graduated magna cum laude from the University of Pennsylvania and received her medical degree from Cornell Medical College. After her emergency medicine residency in New York City, she practiced in Los Angeles until becoming severely ill as a result of a complex medical condition known as chemical sensitivity or environmental illness. Her story of survival and journey of discovery led her to learn about the field of environmental medicine and its focus on finding the cause of disease, including genetic, hormonal, nutritional, allergic, and environmental factors. She is now president of Preventive and Environmental Health Alliance, which focuses on educating medical students, doctors, the AMA, Congress, and the public about environmental illnesses. Over 75 million people develop environmental illnesses in this country, such as autoimmunity, autism, and chronic Lyme. Dr. Nagy has spoken at the University of Pennsylvania Medical School, the EPA in Boston, and the National Institutes of Health on the health effects of mold after Superstorm Sandy in New York City. She serves on the board of the American Academy of Environmental Medicine. And in November at our conference, she will be speaking on how to bring environmental medicine to your practice, diagnosing and treating. Dr. Nagy, how are you this morning?
Hi, I'm great. Thank you for having me.
Well, great. So what we'd like to know is what can we expect to hear from you in November? We want our prospective attendees to kind of get a taste of what they might be hearing in November, and just give them a little taste to whet their appetite, so they will come out to hear you in November.
Well, I think that because I'm an ER physician, I'm very practical. And I think what I learned from becoming very severely environmentally ill, probably one of the sickest patients that Dr. Ray in Dallas ever treated, who recovered. And I was disabled, didn't work, and now I have a medical center and I treat people from all over the country at a little practice on Martha's Vineyard, where the air is very clean. That's where I came to recover personally from being intolerant of air pollution, in Los Angeles. I had to leave. And the thing I've learned is that it's hard for doctors to learn how to go out and practice and what to do when they see a patient and they take a history. How do they proceed? So what I'm doing is a step-by-step, one day at a time, how I treat patients, or at least my philosophy. And I know that there's a lot more I could learn. There are a lot of things that I may not do. And so I'm willing to share the patient with other practitioners around the world who may be able to benefit the patient, and I'm not just trying to keep the patient basically to myself. And then I think that's one of the main things to learn, is that it's not about money, it's not about your practice, it's about somebody who's on death's door and trying to help them to get well, or somebody who's just mildly ill, but you don't offer what they need, but you recognize it and you know where to refer them so that they can go do what you can't provide. So if you're not versed in hormone management, and you think they have adrenal insufficiency or low testosterone, but you don't really know how to treat it, then you send them to somebody else, or you let them be on their journey, and they'll come to you for what you do. The other thing I wanted to make sure that I correct is that in my bio that you were talking about, I am now like a government liaison for the Academy of Environmental Medicine, not really on the board anymore. And in that government liaison role, I spoke at NIEHS, the National Institute for Environmental Health Sciences, on May 9th of 2016, and I discussed exactly what I'm saying now. So it's how do we approach a patient, whether the subject at that time was obesity, mold toxicity called mycotoxicosis, and electrical intolerance called EMF sensitivity. And I brought experts in those areas, and we discussed the utility of environmental medicine in treating basically many or all disease, chronic disease. Obviously, if you break your arm, you're going to have to go and have an orthopedist, fix it. It's not like you're going to do environmental medicine just to repair the acute injuries or diseases of the modern day. But for chronic disease, we really do have, I think, an advantage over some of the other practices like regular integrative medicine. And my pitch is to say that if integrative medicine cannot show that we can cure some people and fix them and save a lot of money, that there will be no incentive for insurance companies to pay for it. So we need to merge environmental medicine in with all of the integrative and functional medicine practices so that we can actually prove you can take somebody with a Lou Gehrig's or a multiple sclerosis or a Parkinson's, and some of them will get well enough to go back to work, be in the workforce, and not be a financial drain on society because they're on disability. And so the way we do that is by taking a great environmental history and saying, well, before you got sick, where were you? What did you get exposed to? Did you get a new job? Did you have a new house? Did you get new cabinets in your kitchen? Did you get a new mattress? Do you have a musty basement? Did you grow up in a home that had a mold problem? And I would say, it's about the total load of your exposure through your lifetime and even intrauterine. So if your mother, was really raised in a moldy home and then she produces children that may be impaired or autistic from her mold exposure or her pesticide exposure, and the whole concept of epigenetics, changing the genetic programming basically for the fetus so that when we develop, we do not have a normal, let's say, chance of being tolerant of chemicals and foods as we grow up. So the total load concept from Dr. Randolph and Dr. Ray and all these people from the 1950s who discovered environmental medicine is the key. And then when you have an exposure in your 30s or 40s, I say that it's as the hormones decline that the environmental exposures add up, and we become potentially more fatigued or chemically sensitive. And if somebody, this is the key, is using perfume or commercial detergent and fabric softener, they will not be able to tell that they're chemically sensitive. So the first thing in my practice, this sounds a little complicated, I have scrubs, and I have a shower, and I have saunas as well for the showers to be used after. But the basic idea is that the patient who comes in who smells very pungent, whether it's mold or detergent or perfume, they get into clean clothing after a shower, and then they live in that clean clothing for 4 days. And they can get other clothes or whatever, but they will unmask and become sensitive to their own detergent, their own moldy clothes, and other scents in society once they've unmasked for those 3 or 4 days. And they will no longer like to use detergent or perfume after that fact. And I think most people who go through this period of unmasking, who think they're normal, will then realize the effect of chemicals and like pesticide sprays or scented products that are very potent, that aren't even a chemical, but they're natural. They will bother them, and they will no longer be able to use them in a comfortable fashion. And that's the beginning of getting well. Then I deal with dysautonomia, adrenal insufficiency on the first day and the second day. I do testing. And then I start treating the patient if they have dysautonomia right away, and I teach how to treat that. And then we start doing, IV therapy, hormone management, allergy testing, and then eventually when the patient's real stable in a few days to a week or two, they'll do sauna. So I think that's a reasonable summary of what environmental medicine addresses, and I'm sure I've left out, like a bunch of treatments, but I don't want to give it all away before the meeting.
Exactly. Exactly. A lot of patients, they don't know that they are abnormal. When I do some food sensitivity, and I tell patients, just give it a week, get off that food for a week, and then go back to that food, and then I won't have to tell you to not eat that food again, because now you will understand what it's doing to you, because they've lived their whole life with this exposure, and they just feel like it's normal. They just know that they're fatigued. They don't think well. So that's very interesting that you have in your office a way for them to get clean so that they can recognize for themselves what has happened.
It's essential.
To them. Yes.
Yeah. And Dr. Randolph and Wrinkle before him, who was an allergist in the 40s, I believe, they discovered that the 4-day going off a food that you're sensitive to, like milk or gluten, going off for 4 days is the key, and the immune system seems to like the 4-day period of time. Then you test that food all by itself, like a glass of milk, on day 5, and they should have an alarm reaction and get much worse, like a response where they get diarrhea or they get really tired or something, maybe even 30 minutes after having that food. So if they're curious about foods, I try not to, tell the patient something that they don't want to hear, like you've got to go off wheat for the rest of your life, because they get very anxious. They won't come back.
Right.
Anyway, so those are some of the basics of environmental medicine. And I think, the whole idea of mold exposure and how to treat it, really it's environmental medicine physicians. I'll be very firm. It's environmental medicine physicians who are experts in the treatment of mold exposure and environmental illness, and not others who are maybe trying to make a name for themselves, make money on it, write books, and really are not getting patients well and giving them the information to lower their total load by not exposing themselves to chemicals in the home and personal care products, so that they can really get well. So this injustice is my mission in life, and I was in Congress on this and on Veterans Health at the Veterans Health Subcommittee, where there were just like 8 of us in the room, and they took $100 million and focused it on environmental toxicity in veterans, research in this area, after we had a meeting and one of the researchers in dysautonomia decided that I was on to something, and others, I guess, had pointed him in this direction. So people listen when we talk. We just need to get the word out as much as possible.
Well, great, Dr. Nagy. I agree, because it's a very complex subject. I mean, the environment is so heavy laden with all types of toxins. It's not an easy task to try and figure out what's going on. And you're right; these patients can be severely ill, and they don't need to have someone fooling around with them for a year or two,
Right,
and then sending them somewhere else. So I agree totally. Totally, this is not.
Mhm. I tend to interrupt, so I'm sorry, but I thought of something interesting.
Mm-hmm.
What I say is that women, maybe men as well, but women definitely want to get well fast.
Mm-hmm.
And I find that other practitioners that are my, friends and colleagues, they tend to see a patient once a month.
Mm-hmm.
And that's fine if you have a practice of people who are mildly ill. But when somebody is very sick,
Mm-hmm.
you really need to see them daily for the first few days, and then maybe 3 days a week after that, and then maybe 2 days a week. And what I really find helpful is doing IV vitamins 3 days a week for 2 weeks or 4 days in a row. And they get better and better, and they never go back. So once you feel better, they know what it's like. And when they slide back, you figure out what to do. Maybe they do a little treatment of other type, a little sauna. When they slide backwards, you do an IV again to get them back up to that level where they feel reasonable, and they'll never go back. So I always videotape people on the first day, because within a day or two they may feel better, and then there's no way to get that video of the pre-treatment video if you don't do it on day one.
Right. And sometimes they don't realize how bad they were once they get better.
Yep.
Always.
And then they can show it to themselves or their family or their doctor, or if they want to be proactive, they can show it to people in government. We can use it to exemplify before and after, 5 days after treatment, how much better somebody can be. It's really dramatic.
Right. Well, great, Dr. Nagy. We don't want to give away too much, but this is an interesting topic, so I have to stop myself from asking you more. So we're really looking forward to having you in November. A fascinating subject. We are so happy that you're going to bring your wealth of knowledge to our attendees, and again, we look forward to it, and we thank you for taking time out today to do this interview.
Thank you. I'm honored to be invited.
Well, great. All right, Dr. Nagy, thank you so much, and we'll see you in November.
Okay.
All right.